Hello, I'd like to share some information with you today in regards to is it a possibility of you becoming desensitized to death? This information is coming from verywellmind.com, written by Sarah Shepard, medically reviewed by Stephen Gaines. So, with the frequency at which we all are experiencing something that can lessen our sensitivity to it, when you're exposed to death on a regular basis, a person can become desensitized to it, affecting the way that you empathize, mourn, and grieve. So the basics to desensitization, that can be used to treat phobias, at times fears, other mental health disorders. It can be and can help you train your brain to remove the anxiety or fear from accompanying triggers, inducing situation, such as driving, seeing a spider, things of that nature. The treatment may start with an imagination and end with exposure to remove the trauma, minimizing the fear and desensitizing you to the situation. So you're not operating out of panic, fear, anxiety when you experience it in real life. While desensitization, can be beneficial for a person's mental health, it can also be detrimental. So if you become desensitized to violence and/or death, you can become less sensitive to others' suffering, lose the ability to empathize, and start behaving in more aggressive manners. So you want to be mindful of that. So here are some signs and symptoms to possibly being desensitized to loss, grief, death. So while there's no normal reaction to death, it is natural to grieve and mourn. After the loss, you may feel shock, guilt, anger, numbness, helplessness, sadness, or even yearning. Not experiencing an emotion reaction to death or not empathizing with someone who is grieving may be a sign of becoming desensitized. So if you're experiencing desensitized and becoming desensitized to death, you may exhibit some of the following, but this is not all inclusive. Inability to mourn, lack of grief, comic responses to death, apathy. So you may not cry, you may not feel sad or angry, you may continue with your day as nothing has even happened. So some risk factors that are involved with possibly becoming desensitized to death is putting yourself in situations where death is inevitable, such as trauma units on war. Desensitizing can be a benefit in a survival mode. So avoiding the emotions associated with death may make it easier to deal with the constant exposure. Still, though, it can harm your mental health and your relationship with others in the long term if it is not addressed. In regards to coping, so if you want to prevent desensitization or practice coping mechanisms, there are some recommendations, some suggestions that can be of assistance. Practicing grounding techniques such as the 5, 4, 3, 2, 1 technique. So when you're more mindful and present, it allows the space to process things in a more intentional and clear way. Minimizing or reducing burnout and compassion fatigue. The more burnout we are, the more likely we are to be cynical, have lower overall satisfaction, and become less compassionate to others. Kind of reducing your stress. The more you can reduce your stress in other areas of your life, the more likely you are to be able to handle difficult situations. Also, attending therapy. If you are finding yourself struggling, finding it difficult to push through those barriers, those memories, experiences, connections, it may be beneficial to speak to a mental health provider. In regards to treatment for becoming, or if you are feeling desensitized to death, um, a form of treatment can be CBT, which I would then also continue encouraging seeking out a mental health provider that can be of assistance to you to support you through that process. You don't, though, do not want to become obsessed with the loss, the death of the individual and or thing. If you're constantly kind of thinking about it or having anxiety, therapy may be helpful. So the takeaway, as all human beings, we know death is inevitable, and it's a natural way to feel emotional when those around us kind of pass on. Grief is not easy to deal with, and though support is available to help you through it. I hope this information was of assistance for you today, and I hope you enjoy the remainder of your day.